these days we have got of screening programs. So what you would like to talk about this?
So screening programs, I think usually the screening program works very well for 3 cancers. One is the breast cancer, cervical cancer and colon cancer, that is the large intestine. So when I want to talk about breast cancer, that is the most commonest cancer throughout the world, and in our country also it is a very common cancer. So I would definitely recommend every female patient, but in Goa the age group is very less. Like all of my patients are very young patients, so once they cross 30 years, I would recommend them to get an ultrasound of the breast at least once in a year, and after 40 years a mammogram, X-ray of the breast. So this has to be compulsorily done every year. For example, what happens is when you do a mammogram, it picks up small calcium deposits in the breast. So the person can be completely normal. There may not be any lump. The breast examination can be normal. But when you do a mammogram, those calcium pattern, that can give an indication that the cancer has already started in the breast.
Achha.
That is how we can prevent a breast cancer and treat it at a very early stage.
Yeah.
Same thing goes with cervical cancer. When you do pap smear, so this has to start from the age of 21 years. And I'm very sure not many people have undergone pap smear at all. You can do a study and see also. But the guideline says once in 3 years, after 21 years, you have to do a pap smear. So when you take the cells from the cervix, that is the area below the vagina, we can see cancerous cells, the earliest changes before a cancer can start. So if that changes are seen, we have a treatment like removal of the uterus and the cancer can be cured 100%. So people are not understanding that importance. Same thing in Goa, I would say the GI cancers are very, very common. Like you do a colonoscopy for any healthy patient above 50 years, there can be some cancerous changes because of the dietary habits. So once in 5 years, after 50 years, every person, male and female, they have to undergo a colonoscopy. So the importance of all these screening programs are to get it done even if you're feeling healthy. Don't wait for something to go wrong. See, our mentality is everyone, each one of us, we wait till something goes wrong. We should not wait till something goes wrong. Every year get your health checkup done. That is how you can prevent most of the problems.